No, you are certainly a light in the darkness as far as X is concerned. I
Well,
feel like we
thanks.
need normal, rational people on X.
I feel like I am the crazy one for just being a normal person, right? But like, actually, when I talk to everyone around me, most people are pretty normal, right? But I don't know. We live in these sensational times, I guess.
I tried Blue Sky for a little while. That
How
was
was it?
I couldn't.
I haven't given it a shot.
I think I
I've
said
seen
something
that.
like 1+1 is 2, and I mean, like they're like, your last name's Rojas. This is offensive, and I just went, okay, this is not for me. I've not tried Truth Social, so I just kind of stuck to the
Yep.
basics. Like I'm
Me
on
too.
X
Me
and
too.
LinkedIn.
Me
Those are the
too.
two for me.
That's it.
I can't do, I'm trying. I was told by everybody you got to do Instagram, and I'm like, okay, but I'm not
I
like
can't
I'm
stand it.
really. You tried it?
I try. I mean, my team asked me to do it, and I repost things and whatever. But I just despise it. I don't like social media that much. X is different because I can just like run my mouth on random things. It's like stream of consciousness stuff, right? But it's a little, yeah. There's, anyways, we're all talking about some good stuff here, so I am
Yes.
excited to chat with you.
Well, look, I want to talk about living to 150. You just did a video where you talked about living. I'm probably one of the few that wants to live for, I'm having so much fun that I want to live to 150.
You know what's
Hey,
interesting, Dutch,
yeah,
is
tell me
like
about that. Cause I heard it from your lips and I was like, yes, that's what I want.
when I talk to very healthy, thriving 85 and 90-year-olds, they all say something like, yeah, I would be fine if I passed away tomorrow and most of my friends are dead and my spouse is dead and whatever. I've come to terms with who I am and what the afterlife is, whatever. But do I want to? No, I've got an Iron Man coming up, right? Like I'm still thriving and living my life. I think what people fear is decline, is being in a place where you can't remember yourself or your children, where you're not functional, where you're not able to care for yourself. Some of us want to be running marathons when we're 80 and 90, and we care for patients like that who want to optimize. And we can talk about our strategies there and why I
I want
actually
to hear
believe.
I want to hear all about it. I want to
I
hear
actually
everything.
think
If you talk the whole time, I'll be super happy. Tell me everything
there
about living to
are
150.
folks that believe that the biological constraint of humanity is around 120 years old, which is hard to argue with. We've never really had an example of human beings living longer than that. But I don't think that that paradigm takes into account things like, call it Neuralink, right? Like where now someone has something implanted into their brain who has completely changed their lives. You can control their limbs with thought when they were previously paralyzed, right? When we talk about CRISPR, and there's a upgraded CRISPR form now where you can be very specific and cleave out certain things. Like we don't know what the realm of possibility is. And this era and this time is so exciting, right? We all feel it. We all see the AI stuff coming. Some people think it's a whole bubble and a whatever. Like I think most of us see it. Well, this is kind of the internet. Like this is how transformative this technology is going to be. And when you apply that to human discovery, when you apply that to scientific discovery on, we already have GPT basically, you know, matching some of our diagnostic capabilities. There's all sorts of nuance there that we can get into. But when it starts discovering new things, new molecules, new ways of treating conditions, like we don't know is my answer. And so my argument is that the next 20 and 30 years are going to see such amazing advancement and at such a rapid pace that our job, it's not about like living to 150. It's about being as healthy as you can for the next 20, 30 years so that you can give yourself optionality to whatever this new world brings us. It might feel dramatic where we have breakthrough treatments in certain conditions, and others will feel sort of subtle. Even the name of our clinic, Velocity Health Clinic, is built off of this principle of longevity, escape velocity, in that in a subtle way, what we will see as we continue to advance is that life expectancy will get pushed out 5 years every 5 years, call it. So you turn 60 next year and life expectancy is 85. You turn 65 and life expectancy is 90. You kind of just never catch up. and you let science kind of back you up there, right? So I think it's not implausible to say those things, not ridiculous to say those things. I think there's a very reasonable path to see many of us alive today live to 150. I think the quality of that life is important. Go ahead.
No, I was going to say, like, how do we help people get there? Like, I, I, I'm a runner, ran in the Marine Corps, played soccer in college. I love to run. Didn't run for about 10 years, started running again 3 or 4 years ago. It's something that brings me joy, wholeness, peace, serenity, all these things, right? How do we encourage people? Like, when you meet these people who are 80, 85, 75, in that age, like, what common characteristics do they have that you go, wow? I mean, because when I meet those kind of people, like, I take notice and I want to like buy them coffee and sit with them. Like, can you just teach me everything? Because you have an
Yep.
amazing life and I want to be like you. I want to
Yeah,
see
I
my
mean,
grandchildren and my great grandchildren. Like,
that's what
what do
most
they
of us
have?
want. I think
Yeah.
that's what most of us want. When you watch these sort of blue zones and study these populations that tend to live longer
Yes.
and live happier and healthier, they tend to share a few characteristics. Whether or not, like, there's all sorts of people that'll be in the comments here and say, oh, well, the blue zone stuff has been disproven or whatever. But by and large, when you watch people who live happy, healthy, long lives, they share a few characteristics. Daily movement, by far, is one of them. Connection with community, meaning social isolation, is typically a morbidity and mortality factor. And purpose, doing something that is meaningful to them, and having sort of a shared vision or community or things like that. It's not the bodybuilders out there. And you talked about running. VO2 max is something we measure in every single one of our patients. And I think, for the listeners that don't know, that's when you see these athletes wearing a mask and they're running on a treadmill or a bike, that is testing all sorts of different organ systems in our body. But it is one of the most predictive statistics we have on all-cause mortality. If you are a lifelong smoker, you have about 40% higher chance of all-cause mortality in the next year versus a non-smoker. If you have a low VO2 max versus a high VO2 max, you have a 400% higher chance of death in the next year. So that's how important something like cardiovascular fitness is. I think, we stress muscle mass as well. Sarcopenia is real. Functional decline is something that none of us want. We'll lose about 10% of our muscle mass per decade. And that takes conscious effort. I think everyone needs to be engaging in some kind of resistance training to preserve that. It doesn't need to be slanging weights in the gym. It can be resistance bands. It can be body weight stuff. You just need to be putting tension on your muscles and pushing yourself in some way. Sleep is probably the other biggest pillar, that and mental health. And we'll talk about that one. But sleep is probably where it all starts. And I see so many founders, so many CEOs, so many, performance-minded individuals who have traded their, success in life and their drive for sleep. And it kills people, literally. I mean, the data is so overwhelming that poor sleep correlates with all sorts of downstream impacts, including worse outcomes for those who have a predisposition for dementia. We check a gene called ApoE on all of our patients. And, just to back up 1 second, that you mentioned, like, how do you do this for as many people as possible, right? It's not the current American healthcare system, right? It is not the fee for service, 7-minute churn and burn primary care appointments. I practiced like that for a decade. And this is my way of being the change I want to see in the world. And I think we have to start with small populations, test this, and then democratize this. There's a whole payment mechanism for this that you and I could probably talk for hours about. And then there's the science and the structure of that. And so paired with that, deep science of how we optimize each of those things is an interdisciplinary team. What we would hope would happen for ourselves and our family, where your physician is talking to your dietitian, who's talking to your health coach, who's talking to your concierge, who's talking to your cardiologist. We're all in the same room together. You, Dutch, are what we have in mind, and how do we coordinate to get the best plan for you? Every single one of us has our own complex fabric of our lives and our culture and what's important to us and what we have access to and our families, all these different things, right? Like, that level of personalization is what we think American healthcare needs. How you scale that is a different question, but
Different question.
that's what we want to show.
You talk about purpose. How did you decide that your purpose was to help people live longer, stronger, more fulfilled lives? How did you decide that? And then where did Velocity come in? Because I saw you're so involved with so many things. You have so much expertise. You're like in capital markets, then you're in AI and tech, then you're over here, then and I'm like, wow, there's so much that encompasses what you discuss. Tell me a little bit about the velocity side and just kind of where
Yeah.
your heart went. Like,
Yeah.
this is where I want to spend the depth of my time.
Sure. I grew up in a family of physicians. My father was a family doctor. I remember very distinctly conversations around the dinner table where he's like muttering under his breath, these goddamn administrators. He was part of the first wave of consolidation when HMOs really came up. Like now we're starting to see the mega consolidations, but he was part of the wave where every single clinician used to be a small business person, right? Himself included. And they all started getting bought up by the local health systems and consolidated and whatever. So that is the context by which I understood the system to be very broken. I loved connecting with people. I loved the intellectual side of things, but it was always very clear to me that I was going to be focused on how to re-architecture the system. So, went to places like Kaiser and Harvard and the Mayo Clinic and spent time as an executive and really tried to understand the system and from the inside out. And I bumped that against sort of a personal story, which is 3 of my grandparents died in their 60s from heart attacks. Both of my parents have diabetes. Rushed back to the cath lab with my dad twice now as he's had a heart attack, a physician who's got his numbers controlled. And, we have bad substrate, but there's so much we could have known and done and prevented ahead of time had we been armed with the right kind of information, the right kind of team, and had the right folks to meet us where we are, which is important. And we can come back to that because it's easy to say you got to exercise and you got to diet and you got to, do all these things. But how do you actually fill that into your life? I think that's the part that we're trying to crack with Velocity. And so you take that context of understanding healthcare. I've been part of companies that have been acquired by top 5 health plan in the country. I've been an executive at a big academic medical center. I've done a bunch of startup stuff. And my primary focus is Velocity. I still do some consulting on the side, and that's where you see me kind of involved in things. And I like to keep my finger in the mix, but the focus for me is understanding how broken the system is and then creating an expression of a clinical model that I think works. That exists outside of the health insurance paradigm, that exists outside of hospital system paradigm, that is a physician owned and led organization that values time with patients. Like sometimes people really get into the moat of like, what do you guys do that's different? Like, we give you access to your physician. That's when you really pare it all back. That's what most people are paying us for. So we spend 90 minutes with our patients on intake and 60 minutes every quarter. And they're texting us and emailing us and calling us in between. They've got these health coaches. They feel connected. We're interwoven into their lives. Our docs don't have any more than 250 patients on their panel, which is 1/10 of the typical primary care doctor in this country. So we are trying to recreate what I thought I was going to medical school for, which was a relational field where I can know you intimately and engage with you in different sort of phases of your life and make meaningful impact across all those different phases, whatever that means to you at that moment.
Man, I'm just like, I'm blown away. So when did you get the idea for Velocity and how long has it been around? Is it newer? Is it older? Is it a startup? Is it like
Yep.
going on? And
We're
yeah,
We're a newer organization. So we've been at this concierge precision medicine for about 3 years. We've built clinics across the country to several hundred patients. Our physicians came together at the beginning of this year, and we felt strongly that we needed to own our own destiny going forward. And so we reconstituted, we relaunched, we rebranded. Again, majority physician owned. Every one of them has equity. We raised a little bit of money, but I've been down that road, Dutch. Like I know what it feels like to raise venture capital and PE money. And and, do what you got to do to scale your intervention across the world. What I know is that we have a 96% retention rate. People love us when they join us and they stay with us year over year. What we need to do is get this to the right people who are able and willing to think about their health in a more comprehensive kind of way and have the means or the payment mechanism to pay for that. So
To do it.
things like an HSA or FSA are great ways to do this for folks who have employer-based models. And for those who opt out completely, I think we are an amazing way to have comprehensive wraparound care that's going to keep you healthy and well as long as possible and steer you and guide you through the system. You pair that with a catastrophic, if we had that, like a health shares potentially type program. But when we lobby hard enough to get catastrophic plans back, then that's the path forward I see
That's
for
the
a
path
lot
forward,
of Americans.
Tell me, what is medicine 3.0? I keep hearing it from different docs around the country.
Yeah.
I've heard you talk about it. Tell me what it is.
I don't know who I should really attribute this to. I think most people would say it's Dr. Peter Attia. If you don't know him, he's a longevity physician who's just on 60 Minutes. Medicine 1.0 was kind of the very earliest iteration of medicine, shaman and natural remedies and all sorts of things. Everything's kind of in that bucket. Medicine 2.0 is really what we see now, which is amazing. We shouldn't discount that, right? Like, antibiotics save life, angioplasty save lives. Like, if I had Parkinson's and needed a deep brain stimulator, I would want to be in the United States. And that's what medicine 2.0 is great at. There is a payment mechanism that I think we bumped up against medicine 2.0, which has exacerbated a pathology of just volume burning insurance. Procedural, RVU based, do more stuff to get paid more. And that has such downstream implications to how capital is allocated, what kind of devices are approved, like all sorts of things people peg back to the reimbursement strategy overall. And so, I think we need to step back and think about how we can deliver care in a different kind of way. And for us, not using insurance and being able to, we compete on people's health and whether they actually feel like they're driving value from us or not, right? Like, it's not because your employer is contracted with my health system that we are engaged in this relationship. If you're not feeling benefit from our economic exchange, you take your dollars and you go elsewhere, right? And that's how
Isn't that amazing? Like, it's value.
It's actual free market, and we want to compete in that. I think an interesting thing about this space is like this whole wellness sort of space, and I'll tie this back to medicine 3.0, is like medicine 2.0 is still all of this kind of do stuff, treat disease. Medicine 3.0 is really taking a first principles thinking approach and says, how do we prevent disease at a highly personalized way, where we are rooting out and trying to find what might be wrong with you before you present with an actual disease like diabetes or cancer. Two great examples. Patients come to us, if you're 35, like a lot of recommendations say, don't even check labs on someone like that, right? But you come to us and we miss that opportunity. We get a hemoglobin A1C, it's 5.3. We tell you, come back. You're fine. Then 45 hits and all of a sudden you have diabetes. Okay, great. Now I can do something. I've got this medication for you. Well, where were you for the whole decade before that, where we could have intervened on those things? And there's all sorts of tests we know. We can measure objectively insulin resistance building over time. It is one of the first and most predictive measures, something called your lipoprotein insulin resistance score, of downstream development of diabetes. Shows up elevated at least a decade before your hemoglobin A1 would be. There's all sorts of data, all sorts of guidelines that say we should be checking these things, but it doesn't happen. We don't diffuse that into our clinical practice. Medicine 3.0 is really meant to be this hyper-individualized approach. I think the iteration that I would take on that is that it has to be paired with the right kind of payment infrastructure to make that happen. Otherwise, it's only going to be a vanity product for those that can kind of afford it, right?
Afford it, yeah.
And not to say that that's not like the wrong place to start, right? Like Tesla started with the $90,000 model and showed traction and then found ways to democratize that. And I think that will continue to happen as well. But go ahead.
Yeah, look, I think that's how everything starts.
Right.
I mean, a lot of the reactions we get on social media are very simple. Well, what are you doing for the poor? Well, that's not how innovation starts. That's not how it begins. I'm sorry.
Exactly.
The poor people didn't buy a $1,000 IBM mainframe and put it in their 30th floor New York building. They didn't do that, but we got there, right? And we have to do it this way. We have to raise money. We have to raise capital. We have to deploy ideas that don't work. All right. So tell me a little bit, like, I loved hearing about velocity. I want to talk way more about it the next time we have a conversation. Tell me a little bit about what the next 4, 5, 6 months looks like on the policy side. I know you have thoughts. I want to understand. We've got these ACA subsidies coming up. We've got right versus left. You and I see the world in a similar way. And so I feel like, why ask? But I think it's important to hear from physicians, like, it's kind of not a right and left issue. It's kind of a human issue. And we have to address these issues. And, why do we need to let physicians lead? And when I think I kind of wrap onto accounts like yours on social, because I go, look, he's leading by example. So where do we go in the next 60, 90, 120 days? Kind of where are we at?
Well, we got to open government again, I guess, right?
Yes.
To get anything done. So let's see what happens. We are recording this on a historic New York City election day. So we'll see
That's
how
right.
that sort of plays out and what the repercussions are. And, there's a lot of thought that once we get through this, folks will come back to the table, start chatting, and open things back up. But my gut sense is nothing happens in the short term with healthcare, right? Like always, it's an easy thing to sort of kick the can down. I mean, the ACA subsidies that are tied to this government shutdown, it's kind of crazy when you think about, like, what are you arguing for, actually? You're arguing for $800 billion of subsidies to be paid to the 5 biggest for-profit health insurers that have denied care and screwed you for the last 30 years. What are you actually defending, right? And there's an access issue, I think, but the ACA, look, there's a raw part of this discussion, which is I used to be in medical school. I was the Single Payer Action Network chapter lead for my medical school. Like, that's how bought in I was to the belief that we needed a government-run, government-subsidized single-payer system. And, you'd look at the comparative statistics around that. And in the last 20 years of clinical practice has proven that wrong every single day of my life. And I've seen so many different ways that this has played out. And even with the ACA, I mean, it was I think there was noble intentions around trying to get access to as many people as you can, but it was a fool's errand because, like, you're spreading a product to even more people that then are forced to purchase it and now can't afford it. And now you have to launch all these subsidies. Like, we haven't done anything to bend the cost curve or improve quality. And maybe more people have health insurance coverage, but that means nothing to access, right? Do any of us feel like we have better access to physicians, even those of us who are insured? Can you get into your specialist sooner or than you could 20 years ago, right? Everyone answers that question. Everyone knows. So people have health coverage, but when half of these plans are $10,000 out of pocket to start with, and, like, who did you actually help? You made it up that you were helping people. You actually just forced a bunch of people to give more of a margin to health plans. So I don't know at what point we start to roll that back. It feels, Dutch, like there's a cultural zeitgeist, like a tipping point in the consciousness, right? Like, I want to believe that. The pessimistic side of me says, like, this happens every year, like open enrollment, it's getting 20% increases in your premiums, everyone complains, and then you just kind of lay down and take it. And then you just do it again the next year, and you do it again the next year, right? And at what point is it unsustainable? Like a 20% year over year line item growth in an expense for your company for 20 straight years, like I would have expected year 5 that becomes unsustainable. But here we are 20 years later. So I think it's on the employers a little bit as well, just as, as Mr. Cuban sometimes says. I don't agree with him on everything, but I think he is right to call out, like, a CFO and CEO of most self-insured companies, like, they are subsidizing essentially the entire healthcare system. As an executive at a big academic medical system, like, we basically broke even on Medicare and Medicaid. Medicare, we lost money on Medicaid. We made all of our money on commercial, which is employer-based healthcare, right? Like, how do you divorce that and start to unroll that back? I'm not sure. I think you at least roll back the clause that has minimum essential requirements for the ACA that allows us to have catastrophic coverage, and you allow much more tax advantaged, lenient opportunities for matching funds that can be applied more broadly than just paying for healthcare premiums, but things like your running shoes and your gym memberships and healthy food delivery options and the infrastructure that we all know actually drives real health, and give consumers some credit that they can actually make those decisions for themselves. And the ones that need full coverage, like if you have 10 chronic conditions and you're on a bunch of medications, traditional insurance might be your best option. There's probably a lot of options outside of that, but that might be your best option. So it's not about like blowing that up completely, right? It might be the best, but for the vast majority of us that are paying into the system, that are subsidizing the entire system, it makes no sense. Really weird for me to like see someone like Marjorie Taylor Greene and like, I'm agreeing with like almost everything this person's saying, right? And she's whatever your politics are, doesn't matter. My point is like what she's tapping into is she is a mom and she sees her kids who are about to probably age out of her health insurance and be like, Mom, what the, like, I cannot afford that. That's what millions of people are facing every year.